Hello everyone. Today we are going to study about the questions, anatomy questions, important anatomy questions which often come in the examination. Okay, which often comes in the examination. Anatomy 10 marks questions. 10 marks question which often comes in the examination, which you can say the long essay type questions. Marks distribution of the long essay type question is of 10 marks. Important questions are: number 1, important from you can say one of the important topic is the joint and anatomy. So the question comes arise from the describe the shoulder joint anatomy in details. So, shoulder joint anatomy in details. In details means you have to write about the articulation of the articulation of the shoulder joint, then which bones forming the shoulder joint, that is the bones forming the shoulder joint, and next will be the movement of the shoulder joint, muscles involved in the shoulder joints. Okay, so you have to write the details anatomy of the shoulder joint. Next question is describe about the inguinal canal. The inguinal canal anatomy. Under the following headings. What are the number A, boundary of inguinal canal, content of inguinal canal, see mechanism, and lastly detailed applied anatomy is the inguinal hernia. Okay, so this is another important topic in the shoulder joint. Another one is inguinal canal. Next, number 3. I am talking about the 10 marks question. 10 marks question here. Okay. The next question comes from the nerve. Describe the origin course, branches, and applied anatomy of the radial nerve in details. Okay, applied origin anatomy of the radial nerve. Okay, next is number 4. Explain about the medial longitudinal arch of the foot. It is another important question which lower limb anatomy comes often. Next is number 5. Number 5. Describe about the popliteal fossa under the following headings. Number A, always boundaries. Number B, roof. Number C is the floor. Number D is the contents of popliteal fossa. Another important question. Next question, it is also an important one from the lower limb, is the describe the boundaries same roof, floor, and content of femoral triangle. Femoral after popliteal fossa. Another is the femoral triangle. Both of the important topics. Next question. Describe the hip joint and following headings. Number A, articular surface. Number B, ligaments. Number C, movements. Number D, relations. Number E is applied anatomy. The important is the hip joint. Okay. Next important long question. Discuss in details about the external anatomy, internal anatomy or internal structures. Blood supply and relation of heart. Okay. So another important topic is the heart. Next, number 9 is the describe in details about brachial plexus. It's an important topic. Next, number 10. 1 minute to we have discussed this brachial plexus. The questions sometimes may come like this. Details about the brachial plexus under following. Headings like number A, origin. Number B, formation. Number C, branches with root value. Number D, applied anatomy. These are the topics you should know in the brachial plexus. Okay. Next, another number 10 is the important question. Describe about the anatomy of blood supply to brain. Anatomy of blood supply to brain, or in short you can say circle of Willis. Okay. Blood supply to brain or circle of Willis. Next question 11. Describe about the external features that supply and lymphatic drainage of stomach. Another important question. Which often comes. Another important question comes from the upper limb, that is the describe the origin, insertion, nerve supply, and action of deltoid muscle. It is another next question is the describe the carotid triangle under the following headings, that is boundaries, B roof, number C floor, number D contents. So carotid triangle is another important topic. Next question number 14. Describe the temporomandibular joint under following headings. A type of joint, articular surface, ligaments, movements with muscle, involved. It's applied anatomy. Well, it's important. It's temporomandibular joint. Next is number 15. I'll say about the give origin, insertion, enough supply, and action of hamstrings hamstring muscles. Here you can hamstring muscles consist of 4 muscles, so you have to write the 4 muscles: origin, insertion, of supply, and action. Hamstring muscle consists of 4 muscles. You have to write the 4 muscles: origin, insertion, knob supply, and action. Next question. Write the root value, course, and relation, branches, and applied anatomy of sciatic nerve. Sciatic nerve. Okay, so next question will be describe the pancreas under the following headings. Number A, situation. Number B, parts. Number C, relation, visceral and peritoneal relation, both relation here. And number D is ducts. Number E is blood supply. Okay. Pancreas is also an important topic of discussion. Next question. 18. Describe adductor canal under following headings. That is situation, and extent. Next, number B is boundaries. C, contains. Number D, applied anatomy or importance. Another important topic is the adductor canal. Okay. Number 19. Next, describe uterus under following headings. Number A, same situation. Number B, normal position. Number C, supports of uterus. Number D, blood supply. Number E, applied or clinical anatomy. Uterus is another topic which often comes. Next question, number 20, describe the lung under following headings, that is mediastinal surface. Here the question may come when the mediastinal surface comes, there the questions may come about right or left lung. Okay. Number B is the hilum of lung. Number C is the bronchopulmonary segment. I will discuss all these topics later on in my lectures. Okay. First, you know about the important questions which comes because your university exam is coming soon. So I'm discussing, so you can go through this before the examinations. Okay. Next is the describe Pons anatomy under following headings like cross anatomy, and number B, transverse section at level of facial colliculus. So bones anatomy. Next, number 22. Describe the knee joint under following headings: articular surface, the ligaments, C, movements with muscle involved, and last, number D, applied anatomy. So important are the shoulder joint, hip joint, and the knee joint. These three are most important. Next, number 23. Classify joints with suitable example of it. Next, describe the elbow joint under following headings: number A, type; B, again articular surface; number C, relation; D, movements and muscle producing movements with muscle producing movements. Lastly, applied anatomy. Number 25. Describe in details about the liver. Okay, so today we are going to see this 25 important 10 marks question which often comes in the examination. Okay, thank you. Next day we'll see the 5 marks questions and short note questions, important questions. Okay.